My name is Emma Beecham and I've worked for Marie Curie Palliative Care Research Department as a research associate since 2010. I'm employed as the link post between Marie Curie and the Louis Dundas Centre for Children's Palliative Care, known as the LDC, based at the Institute of Child Health, also within UCL. And I'm going to talk to you about our research on children and young people's palliative care. So within paediatric palliative care, we focus on research in decision making, the illness experience, service delivery, pain and symptom management, and the barriers to research. So the overarching goal of the LDC is to conduct research that contributes to the reduction of suffering and enhancing well-being and quality of life in lives of children with life-limiting conditions and life-threatening illnesses and their families. I've worked on a number of projects over the years in these streams, in collaboration with colleagues from Marie Curie and clinicians from Great Ormond Street Hospital, so ranging from decision-making in children with brain tumours, experiences of advanced care planning, the lack of evidence in pain interventions in paediatric palliative care, and exploring preferred place of death in children with life-limiting and life-threatening illnesses. So paediatric palliative care is still a relatively new field. Practice has outstripped the evidence base, and in our work we look at the gaps in the knowledge base and where practice and policy don't align as a first step in developing this evidence base. So I'll touch on just a few projects. In our advanced care planning project, we found that contrary to the government pushing for advanced care planning discussions, parents didn't actually want it. So from 18 interviews with parents, we found that parents made decisions jointly with the clinicians on issues from feeding to DNRs. But the overarching message we want to get across to the clinicians is that parents want to keep their options open and not commit to one choice. In addition, conversations on advanced care planning can never be considered closed. And these results have been published in a high-impact journal and at a few different national and international conferences and meetings. Our systematic review about preference in place of death showed that, contrary to the government's agenda, home deaths as the gold standard clinicians should aim for, it's not necessarily the place parents want to be. Preference in place of death is a bit more complex than a simple first, second and third choice. A number of factors are in play. And actually, the opportunity to discuss preference is more important than whether a particular location is chosen or achieved. The work stream continues at the LDC and has been cited in several policy documents. And lastly, I've started work in a very important area in quality of life in children with brain tumours. The results from my systematic review and initial empirical work indicate that parents, healthcare professionals and children don't conceptualise quality of life in the same way, and so this poses some real challenges for decision making for the families. For the parents, the focus was on length of life and time left. Clinicians focused on physical status of the patient and avoiding possible side effects, and the children's quality of life related concerns were more social. This work tells us that at each turning point in the illness, the clinician should elicit what quality of life means to the parents and the child, and not make the assumption that quality of life is linked in whole or even part to physical burden. This review has just been published in print in Qualitative Health Research, and I'm due to present it this May at the EAPC conference in Berlin. The purpose of this research is to make a tangible difference to the lives of children with life-limiting and life-threatening illnesses. Going forward, I see myself continuing to contribute to the myriad of questions and issues surrounding enhancing quality of life in children with life-limiting and life-threatening illnesses.